Hello, everyone. It's Dr. Nirav Pandya. A lot of 49ers fans found out last night that Ricky Pearsall has been out of training camp and preseason games due to a shoulder subluxation. Here's a quick breakdown of what this actually means. Now, the shoulder joint is a ball and socket joint. You've got your ball, which is the humerus, and the socket, which is the glenoid. Now, if the arm is impacted in a certain way, is placed in an extreme position, or you're born with a looser joint, that shoulder joint can basically sublux or dislocate. Now, what's the difference? A shoulder subluxation is when the ball partially comes out of the socket, whereas in a dislocation, that ball completely comes out of the socket. Typically, dislocations have a higher degree of energy that causes the injury to occur. Now, in general, one of the things you get worried about, regardless of whether it's a full dislocation or a subluxation, is whether there's damage to the cartilage around the shoulder joint that helps to keep it in place, which is the labrum, as well as to the capsule, which is the covering of the joint, and the ligaments. In addition, you can worry about injury to the cartilage, as well as the bone, and sometimes the muscles around the shoulder joint. Now, the good news is that typically with a shoulder subluxation, sometimes there may not be damage to these structures, or the structures can be minimally damaged. So essentially, many players who have a shoulder subluxation are treated conservatively, meaning they don't need surgery. Typically, what you're looking through physical therapy and rest is you want to restore range of motion, you want to have no pain, you want to have full strength, and what you want to make sure is that you don't feel like the shoulder is going to pop out or shift out of joint when you're doing football activities. Now, sometimes players can have multiple subluxations where it becomes a recurring issue. If this is the case, sometimes you do need surgery performed, particularly since the structures in the shoulder have been damaged or been stretched out. If there's not that damage, or a shoulder is able to basically be stable through physical therapy, then you don't necessarily need surgery. In general, the return to play timeline for an individualized shoulder subluxation is typically 3 to 4 weeks. That can vary from athlete to athlete, but it's important to note that there are surgical options for this as well as non-surgical options. It's really based on the athlete's position, how their shoulder feels, and what their strength, range of motion, and feelings of the shoulder coming out are during the rehab process. Thank you.